else?
Sure.
Chairwoman, I am here as well.
Else here. Yeah.
I am here.
And then Dr. Leon Harris is here with me also.
Hello.
Hi, Cheryl.
We're just missing two of the presenters. Levine, can you email or text Dr. Chisholm and
I'm here.
Yeah, it looks like they're just.
Hey, Dr. Jackie.
Yvonne.
I know she's very punctual.
Yvonne, did we get a presentation sent around?
No, each of the prospective presenters, we can ask them that if they could, if they have it written up, they could send it to us.
Yeah,
So
that would be good, because otherwise you just curiously scribble notes, and it's harder.
And just for some of the new folks, this is Jean Schmatzer. I'm clerk of council. What we like to say is if you can mute yourselves unless you're actually speaking or asked a question. What we found is that there's a lot of background noise that's inadvertently brought forward when people are trying to speak. So if you could just mute yourselves, that would be great. Thank you.
Can you forward the presentation to me also?
That's a general note to your presenters, Michelle?
Yes.
Okay.
Thank you.
Ashley, you just let me know when it's time to go.
Okay, I think we're ready. You're fine.
All right, thank you. Welcome, everyone. I'd like to call to order the Health and Human Services Committee. Today is Wednesday, July 15th, 2020, and 2 minutes after 1. Can you hear me?
Yeah.
Yes.
All right. So I'd like to call to order this meeting. Can we have a roll call, please, Madam Clerk?
Call the roll, Ms. Conwell.
Present.
Mr. Jones.
Here.
Ms. Brown.
Here.
Mr. Miller.
Present.
Ms. Stevens.
Present.
We have a quorum.
Madam Clerk, has anyone signed in for public comment?
No, no one has submitted any public comment.
Thank you. I'd like to make a motion to approve the minutes from the June 17th meeting. Can I have a second?
This is
Second.
Dan. I'll second.
All right, seconded from Councilman Miller. There were no matters that were referred to the committee today. Excuse me, Dale?
We should have a vote on the minutes.
Oh, I apologize. Rolling down. Can I have a vote? All say aye if you approve the minutes for the June 17th.
Aye.
Okay, minutes have been approved. There were no matters that were referred to the committee, to the Health and Human Services Committee today, but we would like to have a discussion in regards to COVID-19 daycare reopenings. Today, we're present to discuss daycare reopenings in light of the pandemic. This pandemic has uprooted and changed our lives, the way we do business, and how we try to maintain safety and get back to some normalcy in our lives. For those of you who are listening, you are not alone. We are all struggling to put systems in place, change, and adapt to our current conditions. The topic of daycare impacts many families here in Cuyahoga County and is a great concern to those parents that rely on these services, coupled with the concerns of safety when returning back to work and children returning to school. Today, you will hear from several professionals that currently work in some capacity that relates to child care in daycare type settings or school. I would like to start off to introduce the professionals you will hear from today that will share where they are to date within their respective agencies regarding COVID-19. And they were all presented 2 questions to include in their presentations if it applied to their roles. 1, how daycare providers or out of school time program will handle if school districts decide they will have virtual learning for the 2020-2021 school year. And number 2, if daycare providers can't adhere to state mandates due to lack of resources to comply, what roles will the county play? They will state their names and positions they hold at the agencies. So the delivery of presentations will occur in the following order. We will have Billy Osborne, who is up first for Starting Point, Robin Gibson, Cuyahoga County Job and Family Services, Rebecca Dorman, Cuyahoga County Invest in Children, Robin Martin, Family and Children First Council, Dr. Jacqueline Chisholm, the Council for Economic Opportunities in Greater Cleveland, better known as CEOGC, and Dr. Thea Wilson, CEOGC, Zuma Zambala, East End Neighborhood Family Center, as well as Karen Thompson. She's the Chief of Staff of Cleveland Municipal School District. So as a little reminder, Jean told you earlier, a friendly reminder to please keep your microphones on mute until it is time for you to speak. So I would like to open it up first to Billy Osborne. Good afternoon.
Good afternoon, everybody that I didn't say hi to at the beginning. I would really like to be riding with you, Pernell. It really looks nice outside right about now. I am very pleased to report that within our county, child care providers have been absolutely remarkable throughout this whole pandemic epidemic that we've been going through. Many of them opened their doors during the pandemic, the first pandemic phases, and that is both center-based and family child care homes. The numbers were outstanding, and I need to also report that the majority of the slots were not filled to capacity. So that tells you a little bit about the fact that families actually are the driver of the market. They are the market, and they make the decisions as to whether or not they want to enroll their children in childcare. The second phase of the opening pandemic childcare programs, which is all childcare programs, were allowed to open as of May 31st at 12 midnight. And I am happy to report that out of 544 programs that have indicated that they may be opening, 474 centers are open right now today. We have 70 of them that are not open. And when I took a look at who's not open right now, most of those are school-based programs, and we understand why they're not open until schools make the decisions on whether or not they're going to open. We won't know who will actually open. We do have, and Jackie will talk a little bit, we'll talk about CEOGC, but the other Head Start programs are open at this point in time. Also within that 70 number, there are programs that actually provide out of school time childcare. And these are programs that are in licensed childcare programs, and they have not opened yet. And a lot of that is based on, once again, you know, the decisions from the schools, when they will open, how they're going to open. You know, some of our programs actually operate out of schools. And so if the schools aren't open yet, then they can't make those decisions. So that is, and right now I'm not necessarily talking about out of school time funded programs through Family and Children First Council, but I'm talking about licensed out of school time programs. So when we talk about family child care, out of 472 of those programs, 421 are open, and there are 51 that are not. And the majority of those family child care homes are currently listed as inactive, and I'm sure Robin will share a little bit more information about that. And then there's our type A family child care homes. Those are our large family child care homes that can care for larger groups. We have 26 in Cuyahoga County, and right now 25 of them are open and only one is not. As far as programs closing, what we are seeing right now is programs may be closing because of COVID-19 cases coming up. We're trying to keep track of the number of cases, but this is something that programs are not required to report the starting point. They're required to report to the state. But because of our relationships with those child care programs out there, many of them are letting us know so that we're not making referrals to those programs at this particular point in time. We do not have information yet on capacity and enrollment. Our plan is to begin that process on July 1st because we needed to let programs actually get open and actually begin to staff up their programs. We have bought many of those programs, a lot of materials through Kaplan and Lakeshore. And we bought a lot of PPE supplies for those programs to help them to actually open. In our conversations with those programs, we are not hearing any of them talking about closing at this point. I think the first indication was today, and that's all based on what we may hear tonight from our governor. And if and when Cuyahoga County may go to the purple group. If we go to the purple group, we're hearing some providers talk about they will be closing back down. So, and we all understand what's going on. We can't control what's going on. You asked the question about, are there big concerns around the new child staff ratios? Of course, programs are saying that they would like to take care of more kids. And for the most part, those are the administrators saying that. What we've heard from a lot of the teachers is that they like the smaller ratios. They're not seeing as much, a lot of children having social emotional difficulties because there's fewer children in the classroom and they're able to give more attention to each and every child. But the administrators are concerned about being able to actually meet the actual cost. Where starting point stands right now is we stand behind the science. We want to keep our kids alive, we want to keep our parents alive, and we want to keep our teachers alive. And we do want to make sure that our programs are receiving funding to help them to maintain their programming. And so we are really fighting very hard and cooperating with advocacy groups to have an impact, positive impact, I should say, on the federal level, advocating funds for child care to help them to be able to subsidize what it takes to be able to maintain those lower ratios.
Thank you, Billy. I just wanted to ask if there was a correction in, you mentioned July 1st. We're past that. Did you mean August 1st? For when places were open?
Oh, I'm sorry. Yes, I meant the end of July. We are going to start doing our, all the days are running together right now. At the end of July, we will begin our capacity, vacancy, and enrollment, a process where we will be contacting all open programs to determine how many children are actually in care and how many children are not. Our number one concern was that the majority of these programs that are open, that they will be receiving grants from the state. And we know that they're eligible for those grants. If they had children in June, they would receive an allocation in June. If they applied, they had to apply. And if they applied for July and served children in July, they would get a payment in July. Beyond July, we're not sure where we're going as a state. And so we are all waiting to see what the state will be issuing to everybody in regards to what, what the next step would be.
Okay. I would like to open it up to questions because there's 7 presenters and I don't want anybody to, but if we could just hold it in respect to time, 2 questions per council member for Billy, and then we can move on to the next presentation. If you think of something else, jot it down and we'll try to come back to it later. But if while it's fresh on your mind, her presentation. Is there anyone that would like to ask Billy any questions in regards to what she just presented on? Councilwoman Brown.
Thank you, Councilwoman Conwell. I just wanted to ask a question, two quick questions regarding the large home schools you mentioned. You said 25 of the 26 are open. What is the capacity for, or what is the range for what would be considered a large home school? And is there a specific reason the one is closed?
I'm not sure about the one. I would have to actually look to see why that one has not opened. We were just so happy that 25 of them are open. But we will circle back around, and for all I know, my staff probably are on it and are talking to that provider. I just don't have that information at this point. They normally can care for 12 children at a time versus type B, which are the smaller child care homes, can only care for 6.
And is that based, I guess one other question, Councilwoman Conwell, so is that based on size of the home, or how's the capacity determined in and out?
It's determined by law. Those are the definitions by law. And then each home has to measure up. They have to have the 35 square feet per child, but that is determined by law, period.
Okay, thank you. Thank you, Madam Chair.
You're okay. She didn't get to answer one of yours, so you're forgiven. is there
Madam Chair?
Okay,
yes,
Councilman Jones, go ahead.
Thank you. Billy, I'd like to know how long have the daycares been open, or had they closed at some point, and how long have they been open?
If you recall, many of the programs closed the week that the governor made the announcement of when schools should close. Many programs started closing down then, even though they were not ordered to close, because parents started taking their children out of the child care facilities. But child care programs were ordered to close on March the 26th.
Okay.
Except for those programs who we had been working with under the state's authorization to help them to become pandemic providers who were providing childcare for essential workers. And so once we did get enough of those programs up and running across the state, then he shut down all the other childcare programs. And then they were allowed to reopen, let's just say June 1st.
Okay. So since they've been opened on June 1st, the ones that have reopened, what has been the capacity in terms of enrollment? Did you regain 100% of the enrollment? Has it been a portion of parents returning to bring in their children?
We don't know yet, because you can't just go out there when they open and try to determine how many children they have, because just because they open doesn't mean they have children. It means that they open their programs, they meet the requirements, they're ready to go. So we had to give them time to get their enrollment up. Many of those programs sent out surveys to kids, the families that they were previously serving, and then they opened it up to other places in their community. So they've been recruiting. They had to get their staff on board, because many staff are not returning because many of the staff are in the at-risk group of COVID-19. So it's more than just everybody just open up. There are many things that these programs have to take into consideration. And that's why we made the decision not to go out and actually do a capacity enrollment study until August.
Okay. Have you, I know if the study is in August, will there be a study or a tracking of COVID cases between staff and enrolled children?
The state is doing that, and I'm sure Robin will be able to talk about it a little bit more. Robin Gibson will be able to talk about it a little bit more from how that is occurring, particularly with family child care homes. But the information that I reported a little earlier is from providers who trust us, and we're having conversations with their technical assistance specialist that's on my staff, and they'd like to share that information so that we're not actually providing referrals to parents during the time that they're closed, if they have been ordered to be closed by the health department. But each program has to make a report through ODJFS.
Okay. All right. Well, I appreciate it. And I'm glad I can share the blue skies with you, Billy.
Yeah. All right. Any other council members on this, with Billy? All right.
No, thank you.
All right. Moving on. All right. Next up will be Robin Gibson from Cuyahoga County Job and Family Services. Welcome.
Thank you. Thank you for having me. Again, I'm Robin Gibson, child care licensing for Cuyahoga County. So my team monitors, inspects, and approves licenses for family child care providers in Cuyahoga County. That would be both those type A and type B programs that Billy spoke of. Type B being the smaller, can care for up to 6 children at one time, and type A caring for up to 12 children at one time. The numbers that Billy shared are those numbers that we are monitoring at this time. We have 421 type B providers that are open at this time, and 25 type A programs. The programs have gone through a transition. They have gone through many changes as we went through the outcome or the things that have really impacted our child care programs in Cuyahoga County, going from, of course, regular child care to pandemic care. Some of our programs did deliver what we call the pandemic care for essential families, and then some of them decided not to. And then reopening, being able to reopen. And again, some of those are still closed. They went through a period where if they were not going to close, they would be determined to be inactive, so that there was not just a program that was kind of open and out there. Those programs that are not operating at the time, and Billy shared with you, are approximately 51 type B and 1 type A. That might be a combination of programs that were already inactive prior to the pandemic, as well as those that may not have opened due to the pandemic, reopened due to the pandemic. So the question that was on the table prior, why that one type A program was not open, it could be associated with the pandemic, but also it could be because providers are able to go into an inactive status voluntarily at any time. We don't necessarily, in regards to the first question, how providers will handle the whole virtual learning, other than our monitoring of programs and making certain that they have the learning material and equipment in place for child care programs, those things that are developmentally and age appropriate, those areas that need to be in place in programs that cover the developmental domains. Those are the things that we are monitoring. Those things should not have changed for child care before, during, or after the pandemic. So in that virtual learning, what that might touch more on is those school-age children who parents may have to determine what's going to happen with them if there are instances where parents are choosing not to send their children back to school. Then what happens in regards to the child care option, or if there's a schooling option that the child care providers can assume. And so we haven't quite formally had that conversation yet. A lot of this is determined by, what are going to be the requirements. I did look at a lot of the different cities in Cuyahoga and how they are handling the reopening of their school systems. And we've got a wide variety at this point. So it's going to be interesting to see how that will impact our family child care homes, who may be a little more flexible in child care and providing child care. So they may be kind of approached with some of those more creative ways of providing child care. If your second question was in regards to if child care programs, more specifically for me and my team, the family child care providers, if they're not able to adhere to those requirements and maybe even the resources that must be available for them to kind of address any of the pandemic issues. There are, during this time, as Billy shared, child care reopened pretty much, we would say on June 1st. It did open officially on May 29th, but that was a Sunday. So, or a Saturday, one of those 2 days. So officially on June 1st, we transitioned back from pandemic care, which was that care that was available to essential families, back to regular child care with the changes in, for the most part, the number of children that can be in those particular classrooms at one time. The kind of the second thing that happened on our end is that on July 1st is when our team resumed our responsibility to conduct home visits with these programs. And that gave us the opportunity, of course, to kind of monitor and see exactly what's going on in the homes, as well as what's going on, you know, how they are addressing the pandemic rules. The state of Ohio, when they did reopen childcare, they gave an additional set of rules. They were called the the transitional pandemic requirements. Those requirements are in addition to child care rules for the state of Ohio for both child care centers and child care homes. And what that addendum did was gave them additional requirements that they had to meet as it pertained to the pandemic, and how they are to work to keep themselves, the children and their families safe and healthy. A lot of that includes things about hand washing, about what they need to do when children enter the program. Some of the things, most of those things were deeply rooted in a tool that they made available, best practices for reopening childcare, that is available on the state of Ohio website. Excuse me. But those are best practices. So we strongly encourage those, but they were not able to really build those into rule per se. So there are the transitional rules that are required, but then there are the best practices that are strongly recommended. And that allows us, between the two of those, to not only monitor the regular rules, but then also those rules that are available for pandemic. When we are finding that providers may be short on resources or may need additional information or kind of maybe processes, fine-tune their processes that we're doing, that they're required to do, we are making referrals. We certainly refer to Starting Point for any resources. That's always our go-to initially. For any resources or any technical assistance or anything that may be available. But we've also, when we initially returned, I was able to facilitate a meeting that connected a lot of the programs that are connected to childcare. So I had Starting Point and Invest in Children and both childcare licensing units, because as I think as you're listening to me, I refer to childcare homes. And that's because the county monitors child care homes. The state of Ohio monitors child care centers. So although we are very similar, we don't have anyone on that I know of to talk specifically about the monitoring, the resources, the virtual learning, and all of that for child care centers. So we, during that meeting, we were able to kind of pull together all of the information and resources that those agencies, we had both health departments on the call, and we were able to create a pretty easy to use tool, resource tool that gave those childcare programs, both centers and homes, links to click, information directly from the health departments, tools that they can use, and emails that may prove to be useful if they have instances of COVID, billing information, and so on. So that's what we've done thus far. We have just, as I said, we just started visits in July, but we are closely tracking merely by way of just the tool that we have to use for inspections, how many children are in the homes currently. And we have one of our teams just tracking that information just so that we can make it available if necessary.
Thank you, Robin.
Mm-hmm.
Any questions for Ms. Gibson from council? All right.
Madam Chair, I'll ask a question.
All right, Councilman Jones.
And if this is an appropriate question for the right person, you can just let me know. But I was curious as to for the daycare providers, what is the message to parents about what is the message to parents to make them feel comfortable in coming back if we've done what that's the question. What has been the message to parents to make them comfortable in bringing their children back?
Mm-hmm. Well, on a county level, we have not crafted a script or a message that we are sharing with parents. I'm sharing with providers to share with parents. We are definitely encouraging all to be mindful of the governor's information that he's sharing and recommendations there. We do provide resources, or we have, just in the resource tool that I spoke of. That resource tool contains information of how to talk to parents and children about the safety during COVID, practices that they should also follow. So there are some things that come directly from CDC, as well as our local health departments, that help us to help the providers to communicate with the parents.
Have the providers asked for any resources in terms of making their facility or their employees or any aspect, making it more COVID protective?
Well, that was presented automatically. So the best practices was just one of the tools that the state put out, anticipating that there are going to be questions and there's going to be information needed for providers for themselves to feel comfortable. So that information, if you take a look at the State of Ohio website, as well as some of the other tools that are out there, it will show you that there is information that for the State of Ohio, for example, there's a whole, I guess what I would probably call a whole area that if you're a parent that you can click on. So there's an area for parents to click on, for providers to click on, for programs to click on. And I think their goal was to, based on what your issue is, there should be something there to help them through whatever their issues may be.
Okay, thank you.
You're welcome.
All right, any other of my colleagues? All right, I don't see anyone.
Can I just say one other thing?
Yes, Billy.
We do provide the technical assistance to child care providers on all of the state rules and best practices. So yes, providers are asking questions and we are walking them through each of those documents, as well as looking for resources for them to be able to carry out the recommendations that are in those documents. So providers are not just left out there with no place to turn, be it family child care or center-based program.
All right. So many of them know to reach out to Starting Point. They know that already, correct?
Yes, and we are calling all of them.
All right.
We get on their nerves.
Billy, give us a sense of some of the questions that they ask.
I mean, at first they needed to understand what the ratio or the group size change really meant. Under the pandemic license, they could only care for 6 kids. Now they can care for 9, and that can work several different ways for them, depending on the number of teachers that they would have in that classroom. Definitely the number one question is how to be able to find sanitizing supplies. And even though Invest in Children and we have Starting Point and other organizations in our community who have been wonderful, have provided masks, we need to figure out how we're going to provide those masks on a regular basis moving forward beyond August 1st. And being able to purchase the supplies that they need without having to wait 2 to 3 weeks for the company to get it in to be able to send it to them. Those are some of the biggest questions, as well as finding staff for them. So we're trying to recruit to the extent that we can, new people into the field.
Billy, when you talk about masks on a regular basis, is that something that the state has been providing so far?
The state, the way that they are trying to address that is through the grants, which means that programs can use their grants to purchase it. But child care programs are just like all other entities out there, being able to actually find them. Cuyahoga County has just been absolutely wonderful, but the question is, can Cuyahoga County keep that up over a longer period of time to meet the everyday needs beyond August? And beyond July 31st, I think.
That question will go to Leon Harris. Leon, are you coordinating or working with Starting Point in terms of the masks that they've been provided so far, or is that more of a question for Emergency Operations Center?
No, so this is Leon Harris with the Department of Health and Human Services, for the record. And Madam Chairperson, we've worked with Rebecca Dorman, with Robin Martin, as well as with everyone else under the Health and Human Services umbrella to work with their providers, such as Starting Point, around PPE needs, whether it be masks, whether it be face shields, whether it be gloves, hand sanitizer, wipes. So I coordinate those efforts through the Emergency Operations Center, and we try to get a sense or understanding of what is needed, how the frequency of when it's needed, and we get that information within a spreadsheet. And once that's delivered to the Emergency Operations Center, then a form is developed and we send that out. We send distribution dates out. So Starting Point and any other service providers that work with Cuyahoga County or with any of our offices receive those distribution dates. And if they can, for the service providers that we partner with, they are responsible for picking up that PPE. But if we have offices or units within the county, then we can have our storekeepers pick that up and distribute it to certain sites.
Okay, and is this on a, Mr. Harris, is this on a temporary basis? Billy did kind of mention that as long as we can continue to do that. I know the CARES funding kind of ends December 31st. Is there any thoughts that you have in regards to that?
So we haven't heard anything of how temporary or how permanent it is, but we'll continue to work with the Emergency Operations Center to try to find out more information. Right now, we haven't been informed that it's going to stop. We've been informed and asked to continue to make sure that we document the frequency of the PPE that is needed. And I'm sure as I work with Alex Pelham and anyone else at the Emergency Operations Center, they'll inform me of any shortage or any need to look elsewhere for PPE. But until that time, we'll continue to work with the Emergency Operations Center.
Okay, can you, just as a courtesy, and I know that you probably would, just let council staff know if they're, if they're down the road, there begins to be a problem with supplying the daycares with the PPE equipment that they need, so we can be ahead of that instead of behind the curve.
I will do, and that's part of the reason, we ask when we're working with providers and when we're working with everyone, we ask for their estimate of what's needed so that we know how much is needed on a monthly basis. So if we have it, we can start to, develop distribution lists, so they'll have it, and like Billy said, it won't be coming in. It won't take 2 or 3 weeks to come in. We'll have that shipment ready. But again, we'll know early on if it's going to be a shortage. But I'll be sure to let you know if that becomes a problem.
All right, Billy, it's been moving smoothly so far.
Absolutely, the county has been fabulous. I wouldn't want to live anywhere else.
All right, thank you. So we will move on to the next speaker, presenter for today, and that will be Rebecca Dorman, if she can state her name and the position that she holds. Welcome, Rebecca.
Thank you. Rebecca Dorman, Director of Invest in Children, County Office of Early Childhood. Good afternoon, everybody. I am going to primarily talk to you about our Universal Pre-Kindergarten program, which is what we like to call the gold standard of preschool in our community. But there were some big picture questions that I actually can give some answers to, because right before this, I was on the State Early Childhood Advisory Council Zoom. So I got a couple statistics hot off the press. So just wanted to share that, and these are statewide numbers, that in June, 91,000 kids who are receiving publicly funded childcare were in childcare, which is about 72% of the kids who were in publicly funded childcare last June. So about 3/4 for the month of June. And Billy alluded to the grants that providers get. For centers, the average amount that a center received for June, which they did have to apply for, and they'd have to reapply for July, but for the month of June, that amount was $14,361 on average across the whole state. So just wanted to fill in a couple numbers that I had just gotten. But I'll turn to our Universal Pre-K program, which, as I said, is our gold standard. Starting Point serves as our partner and lead with us on that. We have contracts with 68 different sites across the county, including 18 of those sites are located in schools within 11 school districts. We have 2 Type B family child care homes. We have Head Start programs, including, of course, COGC, who you're about to hear from. And we also have community-based centers. So we really represent the highest quality that exists across our mixed delivery system of childcare. You heard about the period when there were pandemic providers, and 5 of our Universal Pre-K sites opted for the long haul to be pandemic providers. Some tried and closed, but really 5 stayed with it for the whole time period. 2 of those were Type B homes and 3 were centers. And they were pretty full of kids, and so they were serving kids of essential workers. With the reopening in June, we have 36 of our 68 sites are open currently. We're estimating that they're serving about 1,000 kids now. You heard that the limit in preschool now is 9 children in a classroom with 1 teacher. Our UPK standard is 20 children, and that is actually considered high quality with 2 teachers. You can actually have more kids than that per state licensing rules. So the maximum for a classroom now is a little less than half of what our UPK standards would allow. So you can create additional classrooms if you have the physical space. That's an issue, but I think you can immediately imagine the financial challenge that this is going to present to providers. Type B homes, which are a limit of 6, actually their group sizes are really not affected, which is why they've actually in some ways fared a lot better during this time, and why so many more, I think, were able to stay open as pandemic sites. So what we did to support our programs, first, we anticipated the PPE need, as you were just talking about, and worked with Leon and with our EOC surveyed all of the UPK sites, got their opening dates, and got their staffing and child numbers, and packages were prepared by our emergency ops center, even included masks and sanitizer, even included touchless thermometers, which were hard for folks to get. They had to come to the center and pick it up. And that was so far a one-time gift, but people did tell us they found it helpful. So that was sort of the first thing that we were focused on. We also did get information about dividers and portable sinks, which would allow them to create additional classroom spaces. We couldn't do that for free, but in terms of providing the actual equipment, but we did find them a discount, a way they can use the state discount with one of the vendors that the county works with. And then they could use that grant from the state if they wanted to purchase that, or they could use universal pre-K dollars. So in terms of trying to support them financially, we are raising our rates. The quality dollars are based on a per child amount, and we're going to be raising that in contract amendments because we recognize, again, it's really hard to stay in business when your capacity is so much lower. We're also being much more flexible in how they're able to use the dollars that we provide. So if they want to use it for PPE, et cetera, we understand, and we're being as flexible as we can be on that. We also saw some confusion. So far we've had 2 sites who've contacted us about a staff person who is positive. The first site just was really confused about what to do next. Ended up saying they were going to close for 2 weeks and then realized that they had really sort of overdone it on that. So we reached out to our partners at the Board of Health, and even with everything that is going on, and as you are watching the numbers go up, our County Board of Health is just doing a magnificent job, but under such difficult circumstances. But they pulled together a guidance sheet for us on what to do when either a staff person or a child, excuse me, or a parent of a child tests positive. They've got a next steps for us, which we're about to roll out tomorrow. We're having a meeting with all UPK providers, and we've got a nurse teed up from the Board of Health who's going to walk through it with everybody because people don't know what to do. So literally 5 minutes before this meeting started, we got contacted by another site, staff person, positive, she's about to shut down. I said, no, send them the guidance from the Board of Health. So we're going to get that out to them because I think, again, folks just are very confused about what they need to do to be safe. So we're going to have this meeting with providers tomorrow. We'll talk about that. We've been collecting their policies, and this was an earlier question about what you tell parents. So what we're seeing is the providers have put together, many of them, and you've got 2 providers who'll probably talk about it themselves, letters to parents explaining what's going on now. You don't walk your child inside anymore, et cetera, et cetera. Even as detailed as how do you help a child who has a difficulty making that transition? And this is new because they're used to being walked into the classroom. So there are sort of 2-page policies, and they're like 35-page policies. So we've collected all the policies from our providers. We've put them onto our website with a special link that they can look at. And then again, tomorrow, we're going to have some of the, what we consider the best practice policies. Folks are going to be sharing that with their colleagues and other UPK sites and talking about that. But we are going to be mandating that every center, or every program should have a clear policy. So we're working on that as well. And we've also, Billy alluded to this, we just, Invest in Children just signed on to a letter that Groundwork has sent to the governor and legislature, urging them to advocate at the federal level for the $50 billion bailout that the childcare system needs in order to survive. We feel like we're at a potential crisis moment, and that's the number that's really needed. And we'll see. I so appreciate this meeting today, because sometimes it feels like, even though we know childcare is essential, I sort of feel like Rodney Dangerfield. Sometimes we're not getting the respect that we should be getting in this time. And so I'm really grateful to you that you recognize how important it is. In terms of virtual learning, even when our sites were closed, there was still a lot going on, and Starting Point was still working with sites even when they were closed, as well as the pandemic sites. There's virtual online learning. We have our Ready Rosie family engagement tool, which is all virtual, which has been there for a couple of years. That's worked well, showing activities to do. So there was both child and family engagement going on virtually while closed. And of course, now while open, the sites that have remained closed still do a lot of virtual work. And I think that's sort of, I can pause and see if you have any other questions at this point. But I just actually, again, just to give you a flavor of what's going on. So while we were here, I got a text from one of our larger providers saying, if the governor makes us purple, what's UPK gonna do? So this is like every day. It's every day. Billy can talk about this. I'm sure Karen, everybody can say, like, every day there's something that we're dealing with. And it's been a wild ride, but I think everybody's pulling together, and I am so proud of all of our providers. They've just been amazing. So I'm happy to take questions.
Is there any questions for Rebecca before we move on? I don't see Dale. All right.
Okay.
Well, nothing on that part. Do you have anything else to share with us, Rebecca? They may think of something later on, one thing will connect to what someone else said, but we're just trying to make sure while it was fresh on their mind, they had a
Yeah, I mean, I guess I can't, I think the future is such a big question mark for childcare now in general. We are at an inflection point, and I'm just hoping that the system gets what it needs to be able to survive. And it's going to take a while, I think, for us to shake out. We just don't know what's going to happen. But we are preparing that, site after site. I mean, we've only month, we've got 2 sites already who've had positive cases, who are dealing with that. I mean, they're going to have to at least close a classroom, most likely. So this is going to be with us. And it's just going to be a continuing challenge for providers and those of us who work with providers to keep supporting them. And money is going to be important. So that's about, and PPE is great, but they're going to need some cash flow too. So I'll leave it there.
And that takes our list to 9, Rebecca. 9 that have COVID cases.
And I know of a non-UPK one too. I'll tell you offline.
All right.
So it's happening.
Yeah, and we're hoping that, yeah, it scares all of us, and we're just hoping that we can find out the right mechanisms and going forward that we eliminate or keep down the numbers. I would say eradicate, because I don't want anybody to get it. So now we're going to move on.
Oh, I'm sorry. Can I tell you one other? I'm so sorry.
All right ahead.
I'm so sorry. I totally forgot. We had a child care testing work group as part of the county wide testing things that I led, that Starting Point was on, and some other folks, and advocating to get some special attention to childcare. And what's happened is, as testing has opened up, we don't really need that. but it's still, I just was talking to Terry Allen this morning, and there are very few places you can get children tested. So that is a continuing issue. I'll bring it up tomorrow morning on the call. So I'm sorry, I meant to bring that up.
Good. That's very good information for me to know. Just trying to get a community. Have you had a conversation with Terry Allen? And we could talk offline on that. I don't want to hold up the time, but I understand how hard it is to get people testing, whether adults or children in this time frame.
Yep.
So we will move on next to Robin Martin, Family and Children First Council. Good afternoon and welcome, Robin.
Hi, this is Robin Martin from Family and Children First Council. I really don't have a lot to add other than what Billy said, but I will share what I do know. And the reason I have less information is because I work with the school age kids, and we are waiting on the school districts to determine what their opening status is going to be. And the districts are waiting for the governor's announcement this evening. What I do know is that right now, most districts have entertained 3 options. The first one is a full return with, of course, mask and social distancing. They've also looked at a hybrid model where the kids are split into 2 groups, an A and a B group, where they come 2 to 3 days a week, depending on their age. And then the final group is 100% virtual learning, which they'll offer regardless because they understand that some students and families are at high risk with health conditions and may not be able to come back into the building. In terms of what we have been doing with out of school time, we ended the 4th quarter of last school district with 30 programs operating. We had the majority of them were virtual, and we had a couple that were youth check-in programs. Over the summer, most of our programs have been virtual, and some programs have been a hybrid, but I know the hybrid programs, for example, one that I'm familiar with, the in-person portion of the program is done outside, and the kids wear masks and they do the social distancing. We are waiting for the announcement this afternoon so that we can begin planning with our current contractors. The majority of our contractors work with kids kindergarten through graduation. And what we are aiming to do is work within our existing contracts to repurpose funding to support families, because we know the major issues that we need to look at are addressing the digital divide that our children have, which the schools have been working on with the distribution of the Chromebooks. But there's also the issue of some of our young people have to go to the libraries and sit in the parking lot to get service. And so we really need, I think, as a community to look at that. Again, as far as the county is concerned, we're working within our existing contracts. And I have a call in to the Educational Service Center as soon as all of the districts have made their final determination, depending on what happens this evening. After they've made their final determination in terms of their status, they will share a spreadsheet with me so that I will know which option or all options the districts have selected.
Okay. So that meeting will occur later on this evening?
The governor's doing a press conference this evening, I think at 5:30.
Okay.
And so some districts have made some soft decisions, but from my conversation with the superintendent at the Educational Service Center, the majority of them are waiting for the announcement this evening before they make any final decisions.
Okay. All right. Does that conclude your presentation, Robin?
Yes.
All right. Is there any questions from the committee? All right. Hearing none, we will move on. They may come back to you, Robin.
That's okay. I'm here.
All right. Dr. Chisholm, you are up.
Hello and good afternoon. First, thank you, Chairwoman, for allowing us this opportunity and for all of our partners in the committee. We appreciate it. I'm going to run through mine fairly quickly. Dr. Wilson, who oversees our Head Start program, can give you more details. Earlier, you talked about how we all adapted to this. And as I think everyone mentioned, this is a train running, we're all trying to keep up with it. For example, before the governor closed the Head Start, or I'm sorry, the daycares or the early childhood centers, we have about 1,300, 1,400 kids in our direct operated sites. So we waited one day to see what would happen. And this is before the governor closed the childcare, but he closed the schools. So we wanted to be available just in case the parents needed us. So out of about 1,400 children, 200 showed up. And so at that point, we knew it may as well just close because parents weren't going to bring the kids here. So at that point, all of us, scrambled trying to figure out how do we do this virtually. One of the issues that I've heard earlier was this digital divide. We've got to address that. And that's something I think that the county could really help us with, because low-income families, invariably, the parents may have a smartphone, and we've heard that they do, but it's very difficult to have your child look at a smartphone to get some educational instruction. So that's something I think we need to address. Just like everyone else, we're looking to see what the governor is going to say. If Cuyahoga County goes to level 4, then we're going to have to shut it down again. So our programs usually run until June 12th, and then we go on a summer hiatus for about 6 weeks, and then we start up again in August. So Dr. Wilson will be able to speak to what we anticipate going forward, but we have to have a plan A, a plan B, a plan C, a plan D, a plan D. We're still trying to figure this out. We are heavily dependent on federal dollars. About 93 to 94% of our funding comes from the Fed, which means that we have to really adhere to what the Feds say. So the Feds told us that it was okay to continue paying our staff their salaries and benefits, which was a major load off for me, because that's what was keeping all of us up at night trying to figure out what we were going to do. But we had to be able to prove that we were providing instruction. So all of our teachers had additional training. We have provided some software, some hardware where we could. Much of that is going to be into our centers. We're starting a summer program. It started yesterday. Dr. Wilson will be able to speak to that, because a lot of these kids, they missed a good portion of, the last part of the academic year. And these are the children who are on their way to kindergarten. Someone mentioned the PPE issue, major problem. I mean, we're all struggling trying to figure out how are we going to provide masks, not only, to the children, but to the staff. The staff is concerned, as they should be. We also talked about, daycare in general, but as a person who has to worry about how you operate it, we also have staff who have childcare issues, and so we have to be mindful of, whatever we do for the general public also applies to our staff. And then finally, I would say, we have been using this word blessed, that we have a lot of support. So we've talked with Starting Point. We have an Ohio Association for Head Start. We've got the Ohio Association for Community Action Agencies. I have been on more Zoom calls in the last few months. I didn't even know what Zoom was until the last few weeks. But we're all trying to support each other as we support our families and as we support our staff. I don't want to forget that part of it, because that's equally important. Staff can't go to work if they don't have childcare. Simple. And quality childcare that's dependable. And then the question becomes, I think people talked about this earlier, what is the information that we're providing our parents? We have to paper our parents with all the information. We're required to do that through the Head Start program. But also we have to do the same thing with our staff. They're concerned about walking into the building, what happens to them. So we're providing disposable face masks for them. We have face shields. We had to purchase, what do you call them, desktop protectors. And none of this was budgeted, but we're in a blessed position in that we do at least have some disposable dollars or dollars that we could reallocate. But the childcare providers, the community childcare providers, don't have access to the same, dollar amounts that we have. And we're mindful of that. The last thing I would say before I turn it over to Dr. Wilson, under normal circumstances, we had about, I think, 80 collaborative partners, childcare centers. that we fund and we help fund their children. Under normal circumstances, we pay for attendance. Well, we switched that to enrollment because we knew that they needed the additional help. So where we can continue doing that, we will. So whatever dollars we have available to us, we're more than happy to continue to support the childhood centers that are out there that we have collaborative partnerships with. And with that, I'll turn it over to Dr. Wilson, and happy to answer any questions after she finishes.
Good afternoon, everyone.
Good afternoon, Dr. Wilson.
I'm to talk about moving forward. We did open Monday with a reduced number of children who are matriculating to kindergarten. We had 75 families sign up for the in-class option, and we've been monitoring attendance, and today, it actually went up. Yesterday it was 58, today was 66. So they are trickling in. Karen, I'm sure you'll enjoy hearing that we're working on kindergarten children to send to you. But you know that our calendar is actually aligned with the Cleveland Schools calendar, so that we found out earlier, before all of this, anytime Cleveland Schools was closed, our children stayed home as well. So that's one of the reasons why we aligned with Cleveland Schools. What we have done is we have added an option to our many options for the fall, virtual. So when you look at our allocation right now in our direct operated, we have about 350 children who will have the option of being and remaining virtual. But we still have our home-based program, which is a little different because that's still a face-to-face situation. We still have our part day and our full day, depending on what parents need. But the bottom line here is that we had to reduce our ratios, just like everyone else. But ours is a little different because we have to maintain Head Start standards as well. So we can only have 9 children. We can have the 9 children, but we have to have 2 teachers in that classroom. Whereas the state says you can have 9 to 1, we have to have 9 to 2, and that's a Head Start regulation. So in many cases, some of our partners are going to struggle with that. So we really can't, some people are dividing their classrooms, and we don't see that's a viable option for us because of the numbers of adults we have to have in the same space as well. So I'll have to say that the summer program is going very well. They have learned how to social distance young children, which is kind of sad because the children are like in, sections of the room, and that's where it's really color coded how they have sectioned off the rooms for the children. They can navigate, but they have to navigate within the color that they are. So if you have a yellow child, then they have to follow the yellow routine and that kind of thing. So it's phenomenal what my staff has done. But for early childhood people who understand early childhood, it's really kind of a sad commentary to see children not being able to really get close to each other and be a part of the classroom. And Dr. Chisholm made mention of our, our dollars. We did get COVID money, and understanding that it is only one time, it's a one-time expenditure for us. One time, and you can only use it one time. That once they gave it to us, that's it. And we have not received it yet, but we know how much it is, and that's the end of it. So we're even looking at how we're going to continue the reoccurring expenditures for items that we truly need in these classrooms. And she is correct. We did switch our payment schedule to enrollment rather than attendance. And we're looking forward to bringing on as many of our partners as we possibly can with the numbers, but they still won't have the numbers that they had previously because of ratios.
All right, Dr. Thea. I just wanted to share that for everybody, but especially going to the point that Dr. Chisholm made, digital divide. I've been saying it. I think all of HHS has been saying it, the committee coming out of their mouths about their districts, knowing that this is a big issue. So currently it's being worked on. It's not finalized yet, but some of the CARES funding, it's being looked at to the CARES funding that the county received to look at. I was just on a conference call, I want to say a week or maybe a week and a half. I'm like you, I don't know my times anymore, in regards to them trying to put together a package to authorize hotspots for the people that need access and for the actual computers themselves for the school children, but their families can use. So it's in the works. You have county council that have been pushing that. We have all been pushing. We know, just like you guys as educators, you can do one thing, you can have the mask or whatever, and whatever school systems decide, whether they're going to do virtual learning or whatever, you need to have that access and they need to have that access. So I just wanted to share that for you. And I think, just wanted to open up, and I don't know if it'll open up a can of worms in terms of your help, your need for PPE, and that your CARES funding has ran out. So Leon, can we have a sidebar on that after? I don't want to put anything out there in the public, but I believe that we should help everybody that we can. So we can have a side conversation about that later. Is that okay?
Yes, ma'am.
All right. Any other questions for Dr. Thea Wilson or Dr. Jackie Chisholm? All right, hearing none at the moment, stay tuned. We will like to open up and welcome Zulma Zabala, and she will state where she's from. Welcome, Zulma.
Thank you. So I'm Zulma Zabala, President and CEO for the phenomenal East End Neighborhood House here in the Buckeye neighborhood. Just to give you a little bit of background on where we've been, we have been open since this entire thing has been going on. We've never closed our doors once. Before the pandemic, we had about 70 to 80 children enrolled. Then we became a pandemic center. When we realized, to the point of communication with our parents, we have kept constant communication with our parents through letters, one-on-one, every step of the way, and everything East End has done has been driven by the voice of our parents. And so it was the parents that made us realize that we should go ahead and apply to become a pandemic center, because we realized that some of them were actually essential employees. And so as such, we were able to support anywhere between 30 to 40 parents with the mandates of spaces and staff, that we had to adhere to. Presently, as that has now changed, as you've learned since June 1st, I only have 20 kids in the building right now, which is extremely low to be able to sustain a child care center. Some of the things that were able to help us maintain thus far since March, when we all had to face the reality of this pandemic, obviously, was the diversity of funds provided by the COVID response funds, by the collaboration of the fabulous philanthropy, people here in town, the foundations and everybody that pulled together, dollars from donors that called us, individually, people knowing what we were doing and knowing that we were open. We got calls. So anywhere from a little check to a big check allowed us to maintain our doors open. And the reason why I'm still open today with 20 kids. And also, obviously, we applied to the CARE Act for the PPP loan. to be able to also help us sustain our staff and operations for the organization and to be able to keep our doors open. We also are a 21st century learning center, and so also dollars from the state still today are very helpful in me having my doors open with 20 kids at the moment. And so obviously funding is extremely critical to be able to sustain these services because, as Billy mentioned, parents are the ones who drive the market. If they're not here, if their children are not here, we can't generate the dollars to operate. Bottom line, that's how it runs. That's how it works. When you look at the numbers that I offered you, in terms of my 70 to 40 to now 20, it should tell you, that this is not just a matter that speaks to those guidelines and procedures that we're dealing with in early childhood, but better connectivity with those matters that affect our parents. That means work across county agencies and entities and initiatives. It has to be one. It can't continue to be in pockets, because if our parents are unemployed, they're not going to get a voucher. They're not going to enroll their children. And then I'm going to be on Woodhill Road, as I was yesterday, stopping a child from hitting what looked like, I think she was maybe 4 years old, probably her sibling, sustaining her little sister outside and in a very dangerous situation because they're not otherwise in my very safe center where they could be learning and safe. And so that's real. We have children on the street again like that is really, really concerning to me. In terms of, again, moving forward with the mandates, listen, we believe that the mandates are necessary. The social distances, our children are masked, our staff is masked, we take temperature every day. We are blessed at East End to have the amount of space that we have, so we were able to space out our classroom. And even in that capacity, we're only able to sustain 27 children safely throughout, and I have a huge facility, we've been here, via the mandates. So again, looking at how we can infuse dollars, continued dollars to support childcare, to continue to operate, whether they're 1 star or 5 stars, because all of that applies. You're not gonna get the same dollars if you're a 1 star versus a 5 star. So we have to look at every single situation when it comes to that funding sources. Understand that, again, enrollment is driven by the reality of the lives of the families that we service. Yes, some are not here because they are afraid. We actually have someone on our board who is a parent who is yet to bring her child to East End, and we understand the fears. We understood when we made the decision to stay open, the risk that we were taking by being present, quite frankly. And so a respectable position for anyone to say, I'm staying home and I'm keeping my child home. But the other reality is that we are servicing the families who are in a very detrimental economic status, and not being at work also mean not being able to eat and survive. A whole other matter, because I'm distributing more food than we have ever distributed before. And so I want to really keep it short, because you all know early childhood is important. We need more money. We need to make sure that we understand the process, that includes the reality of our parents. That means we need to work across agencies and not make this an early childhood matter, but this is a family matter. And so how are we working together to affect those families? And the final thing that I would really like to suggest also is that we got to be nimble in our policies and procedures. Due to the emergency of COVID, we changed a lot of things, right? To be able to make sure that parents got, funding so that they could get food, right? We made certain changes. We included additional dollars here and there. We became nimble in our regulations and policies to be able to address the reality. I think we need to face the fact that we need to remain in that space. It can't just be, oh, okay, we did it up to July, so let's see what happens next. We have to remain nimble, which means we have to remain courageous in our realities on what actually still fits and what doesn't fit. Because just because it looks good on paper doesn't mean that it's implemented in a way that can actually be sustained. So I say that to say that I hope that these type of conversations take place at a deeper level so that we can see where we match and where we don't match. Because I don't have the right answers, but I'm sure that if we all get together somewhere, somehow, we'll be able to figure something out in order to sustain the services that we want to provide for our families. Because we want every child to be safe, and we want every family to be supported in the way that they need to be. So those are my 2 cents.
In light of what you stated, Zoma, I know for a fact that the Health and Human Services Committee members have been having their own questions with administration. I know personally I have, when I've had conversations with David Merriman as we move forward, that we need to be keeping, number one, a recap of everything that we're putting in place in case we ever experience anything like this again. And to look at that, even though COVID has some negative impacts, it really did bring some positive changes and things to enlighten, as you stated, how we can really as people change and to whatever the current situation is. So right. I wanted to give you kudos on that. And I hear you when I'm meeting with you. I do hear you. So I do want to bring all this in, you know, for everybody to share. And I think this is I just want to say an outstanding collaboration. And many of you play a very important role in this county. I would like to open it up to any questions for Zoma at East End Neighborhood House. I thought I saw some faces and expressions, and that's the same one that I had when I learned that she had never closed and she was open during the pandemic. You know, we think about, we put our signs on the yard about the essential workers, thanks for them, but we didn't think about those that had the children. So kudos goes out to East End and all the other centers that were pandemic ready for the essential workers and their children. Any questions? Okay, we'd like to move on and to our last speaker for today. We saved the best for last. Ms. Karen Thompson.
All right, thank you. Thank you, Councilwoman. I'm really thrilled to be here today. And I just want to, it's nice to see so many familiar faces and while it's virtually. But I want to start with where we've been and where we're going. And I'll be very brief, but since the stay-at-home order in March, we kept 22 sites open to be feeding sites, distribution centers for what we were calling our low-tech engagement packets, as well as when we then went to distribution to get technology into our students. And I'm really proud of those 22 sites. Even on holidays, they came in and they worked. So while the rest of us were off on Memorial Day, our 22 sites or centers were open. And so they've just done a tremendous, tremendous job. At our peak, we were serving about 5,000 families a day. From our average has been 3,500. And we continue through the summer. We didn't miss a beat on that. When you lifted earlier about some of the, I don't want to say positive, but there have been some bright lights that have emerged through this work. One of the things that emerged for us, partnership with Channel 43 in engagement and instructional lessons geared from preschool through high school, social emotional learning, has just been, it went really, really well, and we've continued it into the summer. We've also continued into the summer mailing home to our families. I'll date myself, but when we were young, I had 3 sisters. We would get this weekly reader or monthly reader, and we would take turns playing with it. Good, I see some, I'm not speaking. And so that was kind of behind, that was our thinking behind it, that we would continue to engage with our families through the summer and give children something to look forward to. through partnerships with Lakeshore Learning and other entities, we were able to supplement or add to those packets so that families, especially in our younger grades that we're talking about today, could get tactile and things they could manipulate and investigate and explore and continue in that inquiry mindset that is so critical in children's development. Our reality today, and I think you've heard it from Eric, our CEO, we are going slow and trying to pace and have a very thoughtful plan that's laid out. Just to put it in perspective, we have approximately 37,000 students that we're planning for what fall engagement looks like. Of that, about 2,900 are our pre-K population. We have approximately 7,000 staff that we've prepared for, and 100 buildings that we're looking at, school buildings that we're looking at. Or when we looked at the number of classrooms, about 4,200 classrooms that we've been prepping for social distancing. Again, one of the best things that we can do as a district, and that has worked so well, is be hand in hand with critical partners. And University Hospital stepped up and has done walkthroughs with us of our buildings because they've engaged with communities and how do you plan for social distancing. And so we were able to walk through the life of a student, of a high school student, walk through the life of elementary student, so that we could really be thoughtful about how we're preparing our schools for social distancing and remote learning. As with other districts, we are going to have a hybrid plan, and that plan does have to be nimble. We're aligning our plan to the risk level guidance that has been shared by the state. So if we shift to a level 4, we will go full remote learning. When we're in the level 3 and level 2, we will have some type of hybrid that we've lifted. And then when we're in level 1, we will have full insight engagement. And so for the purpose of this conversation and what that means, when we think of our preschool population, we are, as Theo had lifted earlier, we really have to look at space availability and how are we going to support our preschool learners, and what does professional learning look like and engagement look like for the students. And so we are proposing a hybrid model that will be students in our pre-K through 3rd. And I want to preface, this isn't public yet. We've been sharing it, but it will be more outward facing. We're giving pieces at a time, but we are looking at some type of probably 4 days a week engagement. But in our pre-K population, our reality will probably be an AM and a PM. When we mentioned technology,
Thompson, I just want to let you know this is public, so don't say anything that you're not.
Thank you. Okay. I will say technology is critical for us. In March, when we realized surveying our families, we called all of our families. We were able to reach all but about 2,200 families to get valid addresses and mailing, but also sending survey and about to find out what technology needs are. And so we did distribute around 9,000 hotspots to families, and we are aggressively working in partnership with Digital C, City Council, Cleveland Foundation, and other key members in helping to promote, understand what Digital C could bring in terms of access and connectivity for our families. And I was really pleased yesterday. We've been working really hard at our technology one-to-one distribution. It will vary. We're looking in our preschool primary environment, iPad engagement, and for our upper grades, Chromebook or laptop. And so we're about 10,000 devices short to be fully one-to-one, and working on closing that gap. And so we're ready for a hybrid model, as ready as we can be. We have delayed our start. We want to be thoughtful in bringing staff back and creating a learning environment to understand what this new hybrid model looks like, what full remote learning looks like, and what their physical space will be like. So we have a soft opening with our year-round schools. Teachers will return on August 3rd, and students will start engaging on August 24th. For the remainder of our schools, teachers will come back on August 12th, which is a Wednesday, and then students will return or engage in some way on September 8th, or the Tuesday after Memorial Day. I will say our food service team, our transportation team, and our ops team and our safety and security team are all ready to work with families, whether you're in a remote learning day or an on-site engagement day, to support meal access, access to resources. And our external partners, we've had a lot of subcommittee work, and one of our subcommittees is family engagement and community partners. And so our community partners have been really critical in saying, you know, as soon as we know what pieces and parts of the plan look like, they can start to adapt. And so when we say remote learning may be if I'm on an A schedule and I'm in the physical building Monday and Tuesday, and then I'm in a remote environment Wednesday, Thursday, and Friday, there may be an external partner where I can access resources or access services. And so we're working really hard to try to find out meeting our families where they're at, what is needed, and how we can facilitate a hybrid model. And again, we felt it was the best course of action to align our model remote to purple, hybrid to red and orange, and yellow to full on-site, so that it's something if the state is sharing where we're at as a county, as a state, it's not another schedule that families have to, you know, are we a purple day or are we a red day? We have a website up and running, or a link on our website that is all around, it's called Restart CMSD, Opportunity, Equity, and Excellence. There will be daily to weekly engagement with our families through IVRs, through traditional US mail, and through video updates. And one of the pieces I'm really excited about, Say Yes, we continue to move forward with our implementation of Say Yes. And so we'll have another 25 family support specialists come on board, which puts us at 41 schools that will have a family support specialist. And I cannot underscore how critical they were with helping to fill gaps when we were reaching out to families over the month of March, along with our teaching staff, and just helping families connect to services that needed services through very critical times. And they've continued to be a really, really critical resource. So I think, you know, at this point, this is where we're at, more to come, but we continue to, we have a survey out to our families right now, trying to discern from families, what would this mean for the schedule? What's your preference? We have a sense, we've gotten back from families, a certain percentage want to keep their students fully remote, and we will work with them on that. There's another percentage that have a challenge. I have to be at work, and you know, a hybrid schedule is disruptive, and so we're dealing with that. And we've surveyed our staff, because we also have a number of staff members that are high risk. The other piece that I was really pleased with, because our essential workers have never stopped, our custodians, our ESS, our nutrition workers, we created a CMSD COVID response team. What do you do when you do have a positive case reported? We met with the city Department of Health, and they're going to do a training with our nurses so that we can help support contact tracing, because as we bring more and more individuals back, we know the reality will be you'll have somebody will test positive, and so what does that mean? And we are working really hard to have our staff and our students in a sense, I think it was Theo that mentioned like yellow group, red group, you're in a cohort, so that if there is a positive case, you're now dealing with a group of 20 rather than a full faculty of 30 or 100. And so those are stop guards that we've put in place. Nothing's perfect, and we know we'll really be able to learn a lot as we move forward. We do plan to assess on a weekly basis. So when I mention a hybrid model, that does mean one day when there will be no students in the buildings at all. And so that we can do a deep level cleaning, we're shifting our ESS team members so that they're there in the day to help with maintaining the cleanliness of the space. And we will continue to evaluate and assess, and each quarter or every 9 weeks, take a pause, assess what's working and where do we need to tweak with kind of like as educators, a formative assessment cycle. So assess, implement, learn, assess, implement, learn. And so we'll continue to do that throughout this process. So that's where CMSD is at this point in time.
Karen, you mentioned a couple of points, and I'm glad you brought them up in regards to secure nurses. Mm-hmm. And I've heard the community talk a little bit about in the past, pre-COVID-19, that there was more security in school systems versus the nurses. So are we hearing that the nurses will be hired back on full, at full capacity? There will be a nurse at each site, at each school?
No, we will not have a nurse at each site. They will have, depending on what the school environment, some of our schools have very, very, medically fragile students, and they have more of a larger population of support at that school than others. Our reality, as everybody else has mentioned, our reality is we are in a really challenging financial cycle, and we've worked hard not to lay anyone off throughout this full COVID. We do have other supports that we will utilize and that we do utilize, but every school will have a touch with a nurse daily by the scheduling. And Carol Pennington, who has replaced Debbie Aloshin, who just did a phenomenal job as our director of nursing, has officially retired, and Carol Pennington has moved into that position. And she has a very thoughtful schedule of how we'll support this work moving forward.
And then I guess my last question would be, you mentioned that you guys meet frequently across your school district. Has there been any collaborative meetings with other school districts within Cuyahoga County to share?
Oh, yeah.
Okay.
Yeah, absolutely. We are part of the ESC, the Inner Ring, and they've consistently met. Ohio Big 8, Eric is actually the co-chair or chair, and on a national level, he's chairing the Council of Great City Schools, and had the opportunity to testify on a federal level on the inequities of connectivity for city, urban areas and rural areas for students and families. So yeah, it's been, I was actually on the phone with Akron the other day. Ellen McWilliams, they've put out their plan, and we're starting to see trends, and yeah, don't recreate the wheel. How can we support each other?
I'd like to open it up for any questions for Ms. Thompson from my colleagues. Councilman Miller, you're muted, but I saw your mouth moving.
Okay, great. I'm now unmuted. Thank you. Ms. Thompson, thank you very much. And it just reinforced in my mind what a monumental undertaking you have. It's huge under normal conditions, and this adds so much more to the problem. And can you tell us what your expected enrollment is for K to 12?
So we've been monitoring that. We've been monitoring that closely. I will say so. That's why you saw me cheer when Thea said she's sending some more kindergarten. We're maintaining our kindergarten enrollment is down. It has started to pick up once on Monday, or I'm sorry, Tuesday morning. Our plan was released, that first formal communication. So we saw an uptick yesterday and today in enrollment in kindergarten. It's stabilized. We haven't seen any shift at this time in terms of who will be coming back. Families have indicated from the initial survey, and it's early data, but we are able to look at it real time. So looking at data from families, there is a percentage of the population that want to maintain with the district, but want to stay in a remote learning space. And I can understand that. I can understand, we do anticipate, but again, we don't know how those numbers will play out until families move. And I equate it similar to summer school. I may be going to John Hay, but I don't want my child to ride across the city on RTA, and my schedule doesn't allow me to drop them off at John Hay. So for the first 9 weeks, they're going to check in at Rhodes High School because that's our neighborhood school. So we do anticipate that we may have some shift in terms of I go to Tremont Montessori, but I'm going to utilize Mound Elementary School because it's in my backyard and I don't want my child on a bus. And we're prepared for that.
Madam Chair, Ms. Thompson, this is a longer answer than I was looking for. Can you, regardless of whether they're doing it remotely or they're doing it hybrid or they're doing it in person or whatever, just how many K to 12 students are you expecting for the coming year?
I can get specific. Right now we're at 36,564.
Okay. And the other question I had, Madam Chair, Ms. Thompson, is could you refresh my memory on who it is where the teachers are starting on August 3rd and the students are coming in on August 23rd, and then who it is where the teachers start on August 12th and the students start on September 8th?
Sure. Our year-round schools, which are all high schools, and there are 8 in that with the John Hay campus, so 11. So 11 schools, which is what I called a soft opening, teachers will return on the 3rd to start engagement in their professional development. And again, we historically, you have 3 to 5 days of prep before students return for the purpose of being ready for what this looks like. The hybrid learning, we've built in the space of 15 days. All other schools, teachers will return on August 12th, and students will start to engage on the Tuesday after Labor Day. And I'm saying engage because there's a good possibility. I know we're all waiting to hear what this evening brings, 5:30 brings with the mayor. There's a good possibility we could be purple. And if we're purple, engagement will be full remote, or it may not, because we can go out of that prior to, probably for the August 3rd, we would be full remote if we go purple, but then we might move to red. So we just have to be flexible. We can turn it around within a day, which is why we've been really thoughtful about how we create this plan.
Okay, thanks very much, Madam Chair.
All right, any other questions for Ms. Thompson? All right, seeing or hearing none. All right, anything else any of the presenters would like to add or share with us before we wrap it up? All right. I want to thank all.
Could someone send those of us, the presenters, an email to tell us where you want us to send our presentations to?
Okay. Levine will handle that. She's the policy person for HHS. I'm sure she's on.
I know she will.
she'll send that to you.
Okay.
That's all right. She's great at what she does, right?
Yes,
you guys
she is. Yes, she is. I'm her fan.
All right. You got a fan out there, Levine.
You got two. You got two.
All right. I'd like to thank each of you for all who presented today and answered questions. This is a very hot topic, or very topic that I know has been on the back of my mind, just being a grandma and having little ones go back to school at kindergarten and first grade age. You know, you can't, you know, even though your kids are grown, it still impacts you some kind of way, and you want to know. And so if you want to know, you know, there's other people in the community that want to know what is the school system been doing and why has it been quiet. You know, I know it's very hard to, in your perspective, navigation tools you send out to your parents and your providers, but we wanted to have a collective conversation, which I think what today brought. So as a wrap up of today's presentation, you've heard this is a fluid situation. You've heard from professionals about guidance information for providers, collective policies from all providers, out of school time programs updated for school age children, centers remaining open during the pandemic for our essential workers, the digital divide that existed pre-pandemic and now more essential than ever, needs for our county's partners with limited funding provided in regards to PPE, and the county's EOC assistance with PPE, and a lot more. So I didn't mention it all, but I want to thank you all again for your time and attention. So we will now continue on with the rest of our meeting. There's only a little bit left. We will move to miscellaneous business, and that miscellaneous business that I have to share would just like to update the committee members as well as the community partners that are present. Next Wednesday, July 29th at 1 o'clock, we will have another virtual HHS committee meeting, and it will be in regards to Department of Children and Family Services and the issues of children staying inside Jane Edna building. So stay tuned. Please tune in if you'd like to join in that conversation. Anything from my colleagues in regards to miscellaneous business? All right, hearing none.
Madam Chair?
Yes, Councilman Miller.
Did you say the 22nd or the 29th?
29th.
Okay, thanks.
Check my date, but I believe it's the 29th.
Okay.
All right, anything else? All right, this meeting is adjourned. Thank you, everyone.